As you know, so the role of microbiome on patients' outcome, in particular for patients that receive an allogeneic hematopoietic cell transplantations, is now well established. We also have some data that show that there is also an impact of microbiome in the outcome of patients that receive CAR T cell treatments, but also for patients with multiple myeloma, with several papers that establish a link between the microbiome and the minimal residual disease negativity in some patients. So it seems important to develop some strategy to restore the gut microbiome, for example, after allogeneic stem cell transplantation, or before CAR T cell, or also maybe after autologous stem cell transplantation for patients with multiple myeloma. So we developed some pills with microbiome that were easy to give to the patients and that were validated into a Phase IB clinical trial called CIMON. We evaluate them in patients that receive an induction chemotherapy for acute myeloid leukemia. So we know that with high-dose chemotherapy and antibiotics, there is an important dysbiosis, and it could be useful to restore that microbiome. So it was an open-label dose-finding studies when with several cohorts. When for the first cohort we give only 1 pills per week. For the second cohort we give 1 pill per day for 1 week. The third cohort it was 3 pills per day for 1 week. On the final cohort it was 3 pills per day for 2 weeks. And we were able to show that as soon as we give 3 pills per day, even for 1 or 2 weeks, so it was cohort 3 and 4, it was associated with the good engraftment of the FMT product. So we find the bacterial species from the product within the gut of the patient, and it increased the richness of the patient's microbiome. And we were also able to find that in patients that have a good engraftment of the FMT products, it reduces the pro-inflammatory parameters in the patient. So we're able to demonstrate that these treatments with the use of 3 pills per day of FMT that were given with outpatients that take them at home, this is very important, it was associated with the restoration of the gut microbiome. Regarding the safety, it was safe. We have only 4 severe adverse events, and only 1 were possibly related by the investigator. It was a diarrhea from a patient with an Escherichia coli enteropathogenic, but that was not found into the FMT product, but we cannot exclude that FMT can induce this by a mechanism of another. Finally, it seems that this dosage of 3 pills per day is a good dosage to restore the gut microbiome, and we are now going to evaluate this into randomized clinical trial, where we are going to give these treatments before and after allogeneic hematopoietic cell transplantations to prevent graft-versus-host disease and improve patients' outcomes.